Then, Scott, that's really good news as far as the amount of people getting vaccinated and the fact that vaccines work. Great news. But how dangerous is this mixed messaging? I know it's hard because we're getting new information all the time. What is the real world impact with information changing so much?
Well, look, I don't think that the White House messaging has been challenging. I think Jeff Zients, David Kessler, the people from the White House who are working this process have been pretty candid and pretty straightforward. I think that they're challenged by CDC. CDC would much rather put out conclusions rather than data. But in the setting of a current crisis, you need actionable information, real-time data, partial conclusions, and that's not typically what the CDC is accustomed to putting out. They're a high science organization that likes to take its time, put out, very exquisite research in the form of the Morbidity and Mortality Weekly reports. So they'll tell you 4 months from now just how bad this Delta wave was, but they're not putting out real-time information that people can use to partially inform decisions. That's the challenge, and I think the White House has been very deferential to CDC and let them really lead this process, and I think you're seeing the consequences of that. You really need to push the organization to put out more real-time information.
4 months from now, too little, too late. Before that internal CDC document was obtained, you told our colleagues at CNBC that the U.S. could probably get through the worst of the Delta variant surge in the next few weeks. Do you feel the same way now? We've got more info.
Yeah, I still think that's the case. And look, that CDC document that was obtained by the Washington Post, all that information should have been put out. That's the kind of bottom line information that the CDC should be putting out in a real-time fashion to inform decisions that people need to make, local officials need to make. Instead, the CDC prefers to hold on to the information and try to form its own conclusions. I do think when you look at the South right now, you see the RT, the rate of transfer, starting to go down. Now, you still have an expanding epidemic in the South. The RT is still above 1, but it's slowing and it's starting to go on a downward trajectory. So the rate of expansion of the epidemic is slowing in the South. I do think they're starting to roll over. I think we're probably recording at least 1 million infections a day, maybe more. We're not actually recording that. We're not reporting that. But there's a lot of infection around the country right now. And at some point, you're going to start to see this peak. I think maybe certain states have already peaked. You look at Tennessee, the RT has fallen below 1. Even in Florida, which is the epicenter of the national epidemic right now, the RT is starting to fall.
And those people in the hospital are getting younger every day. The CDC director has clarified her recent comments, saying there will be no nationwide vaccine mandate. Do you think there should be one?
Look, I don't think the federal government can mandate the vaccines. These are issues of medical practice left up to states and local authorities. Traditionally, issues of medical practice have been left up to the states. The CDC makes recommendations and is certainly recommending vaccine. I think you're going to see more and more businesses start to mandate vaccinations. I think that businesses and people generally are tired of these waves of infection and see the vaccine as a way out, as a way to, make sure this doesn't happen again. Hopefully, this is our last major wave of infection in this country, and everyone's going to either have immunity through infection or through vaccination. People now have a choice of how they acquire their immunity. So hopefully, we won't see a new variant come through that pierces prior immunity, that reinfects people who've been previously infected or evades the vaccines.
One of the motivators was get vaccinated, we'll put this thing behind us. We watched the Rose Garden ceremony. We saw the president take off his mask. You mentioned a moment ago Jeff Zients and others on the White House COVID task force. Did Andy Slavitt leave the White House too early? He was the person in charge of all of this. So when he left, many people thought, if he's out, we're good to go. Let's get back to normal.
Well, look, Andy was on his 6-month tour. I know him well. Jeff's really running the show from the standpoint of coordinating across all the different components, and David Kessler's running Operation Warp Speed. So the key players are still there. Look, this was always going to be one final wave of infection. We were always going to have a wave of infection. We thought it would be in the fall. We thought it would be with B117. We thought it would be against the backdrop of more vaccination, more people being vaccinated. It's happening earlier with a more contagious variant, with less of the population being vaccinated. But the end game here was always going to be one final wave of infection, and the country was going to be somewhat exhausted, and it was going to sweep over the country with minimal resistance. We weren't going to go back to lockdowns and really intrusive forms of mitigation. So it's just happening against the backdrop of a more vulnerable population. But the end game was always going to be one final wave. Right now, there's 90 million Americans who are eligible to be vaccinated that haven't been. Probably about 40 million of them have had COVID previously from prior waves of infection. So at least 50 million Americans that are vulnerable. I would say we've probably infected about 15 million of them, and there's probably another 15 million to go before you start to see this thing really peter out, before there's no one left really to infect and the velocity of the spread starts to fall.